gel. Okay. And then I place it on the client. Is that comfortable for you? Mm-hmm. Then I'm going to do circular movements. There's 3 methods that we're going to do. We're going to go ahead and do, and I kind of tell the students to do it slowly. And this is a technique-driven procedure. So I'm doing circles, and I'm actually lifting the face as I'm moving the circles. So I'm lifting, 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 lifting. So there's two ways that I work this. I go up, and then I also move up the cheek. And I know that when I'm at 20 minutes, I'm going to go ahead and move to the other side. Then the other thing I do is in a triangle. But the thing about the radio frequency is you don't want to hold it on the client's skin. Like I don't want to sit and stand like this because then they'll feel the heat, especially in the body. So it's a constant, look how I'm doing a triangle, and it's a constant triangular, it's a constant movement. You're never holding it on the skin. And you can notice how I'm also holding the cord away from the client. And then I also go back and forth, sculpting underneath that mandible, okay, because that is a problem for the client. Are you comfortable? Mm-hmm. Okay. Always making sure that my client, so sculpting, 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 and that my client is comfortable. So I will do 10 minutes on the right side, 10 minutes on the left side, and then I will go ahead and work on the eyes and mouth. So, and she's going to feel like a prickling sensation, so I'm going to do it a little bit and see if you're comfortable, if I need to turn it down. Is that too much?
Mm-mm. It's just weird.
You feel a tingling.
Mm-hmm.
Yeah. So with the mouth, kind of like microcurrent, how you're sculpting up, and I'm a little bit lower than half. So everyone, we will mark on the traveler what they're doing. So I mold around like that and really molding up, and a constant movement again. And then with the eye, do you need me to turn it down? Okay. With the eye area, also what I do with microdermal lasers, which is a clever thing to do, is I can pull. We don't want to go above that orbital area. So what I can push it down with my finger. So because that's where women have wrinkles, it's around there. So with the laser or the microderm, you can, because we can't go onto that soft fleshy area, but you can pull it down with your finger a little bit, and then you see how you can get right around that area.
So you want
and
to
then
stay right on the side of the
yeah, then we can go between the brow, lifting and molding and sculpting that area. Is that comfortable for you? Mm-hmm. It is a little prickly and jumpy like the microcurrent, so that's why we start low.
Do you have any gel for that?
Yeah, I have it on there.
Have a different name, that headpiece?
Yeah, this one's called a bipolar.
It's the bipolar. It's the duo.
Yes, because it's going in between the two poles. So, and then again, you can do some lifting, but what we want to make the students aware of, that it's like a massage, that we continual movement, and that we are sculpting that area. And then it will make the skin a little pink with the heat, but you'll see when you get to the other side that the other side is dissipating the heat.
Any particular number of passes that they should do in each of the
Again,
areas?
10 minutes, eyes and lips, 10 minutes together. Okay. So it's 30-minute service. So that's how they know. Also, at the end of the service, they're going to have to show the client their skin. And I'm going to just look at the mirror.